There's a secret to oral care that a hospital will never tell you first. What if I told you that bad breath and gingivitis, which have plagued you for years, could disappear in just a few days? And all without expensive surgery or antibiotics. My name is Dr. John Thompson, a dentist who has been in practice for 38 years. At 75 years old, I still see patients every day. The answer is not an expensive, chemically laden mouthwash. It's in the ingredients we have in our kitchen. Medically speaking, the core of all oral diseases is maintaining the bacterial balance and pH levels in your mouth. You can effectively manage this with natural ingredients. I have witnessed dramatic changes in countless patients using these methods. Just this morning, a patient came in and said, "Dr. Thompson, it's truly amazing. The bad breath I've suffered from for 20 years is gone in a week." This patient was from San Francisco, and this change happened just from rinsing with salt water. How often do you go to the dentist? And from which city are you listening to this story right now? New York, Los Angeles, or somewhere else? Leave a comment below. It can be a great help to others, especially if you share information with people from the same region. Honestly, I didn't believe in these kinds of folk remedies when I was younger. All I learned in medical school was about drugs and surgery, so I wondered if something so simple could really work. I thought that modern medicine was the only correct answer. Then, 10 years ago, my mother, who was 85, was suffering from severe gingivitis. Her gums were bleeding, she couldn't chew her food properly, and she lost a lot of weight. Drug treatment didn't work, and the condition kept coming back. Antibiotics only provided temporary relief. My mother said to me, "Son, I feel like I'm going to die from taking all these medications. My stomach is getting worse. Isn't there another way?" At that moment, I felt so powerless. I felt like a doctor who couldn't heal his own mother. I was keenly aware of the limitations of modern medicine. One day, one of my mother's friends came to visit. She was over 90 years old, but her teeth and gums looked incredibly healthy. When I asked her how she managed her oral health, she said, "I've been rinsing my mouth with salt water since I was young, and sometimes I use vinegar, too." That's when my curiosity was piqued. I started to look into the methods the elderly had used, one by one. At first, I was skeptical, but the results were astonishing. I even researched academic papers and found that the effects of these natural remedies were scientifically proven. I started with my mother, having her rinse her mouth with salt water. I had her dissolve a half teaspoon of natural sea salt in a cup of lukewarm water and rinse her mouth twice a day. After just 3 days, the bleeding from her gums began to decrease. In 1 week, her bad breath improved, and in 1 month, she was a completely different person. She was eating well, and even smiling with confidence. My mother said to me, "Son, this is the wisdom of our grandmothers. Why didn't you tell me this sooner?" That's when I realized that while modern medicine is good, the remedies from the past also have a clear scientific basis. After that, I began recommending these natural mouth rinses to my patients. Of course, along with their existing treatments, the results were consistently surprising. People who had been suffering for 10 or 20 years would get better in just a few weeks. You must listen to this story until the end to get the full picture. If you skip parts, you might end up doing it the wrong way. The wrong concentration or method can actually have a negative effect. If you find this video helpful, please subscribe and give it a thumbs up. Now, let's talk in detail about 5 natural mouth rinses that can make your mouth healthy. I will carefully explain the principles, correct usage, and precautions for each one. 5 natural mouth rinses. Saltwater rinse. The core of a saltwater rinse is the mineral content in natural sea salt. Components like sodium, magnesium, and calcium help regenerate gum tissue. The principle is based on osmosis, where salt water draws bacteria out and dehydrates them. Medically, the high salt concentration makes it difficult for bacteria, especially the anaerobic bacteria that cause bad breath and gingivitis, to survive. The minerals in salt also constrict the blood vessels in the gums, which helps stop bleeding. This is the same principle as putting salt on a wound. It hurts, but it's effective. Mrs. Rodriguez, a 69-year-old woman, had suffered from bleeding gums her whole life. She would wake up with blood on her pillow, but after rinsing with salt water for just 1 week, her bleeding and bad breath were significantly reduced. 2 weeks later, they were almost completely gone, and she now gets compliments from her dentist about how much healthier her gums are. To make a saltwater rinse, add a half teaspoon of natural sea salt to a cup of lukewarm water. Stir until it's completely dissolved and rinse for 30 seconds to 1 minute. I recommend doing this once or twice a day, especially after brushing at night, as it can help stabilize the environment in your mouth while you sleep. A word of caution: start with a weaker concentration and gradually increase it. People with sensitive gums should be especially careful. If you have high blood pressure, consult with your doctor, as your sodium intake may be restricted. Natural sea salt is better than regular table salt because it's richer in minerals. When you rinse, gently massage the area between your tongue and gums. It can be helpful to hold the rinse a little longer in areas where you have inflammation. I always recommend a saltwater rinse first to my patients because it's safe and effective. Have you ever woken up with a sticky, bad-smelling mouth? Baking soda rinse. The key to a baking soda rinse is its alkalinity. The inside of our mouths becomes acidic after we eat, especially after consuming sugary or carbohydrate-rich foods. This acidic environment is a breeding ground for bacteria that cause cavities and gum disease. Baking soda neutralizes this acidity and prevents bacteria from multiplying. In dentistry, the acidity in the mouth is measured by pH. A healthy mouth has a pH of about 7, but it can drop below 5 after a meal, which is when cavity-causing bacteria become active. Baking soda, or sodium bicarbonate, quickly neutralizes this acidic environment. When sodium bicarbonate meets acid, it creates a neutralization reaction, producing carbon dioxide and water. This process adjusts the pH in your mouth. Baking soda also has a mild abrasive effect, which can help prevent plaque buildup. Mrs. Wilson, a 7-year-old woman, was struggling with severe bad breath. She felt so embarrassed that she couldn't get close to her grandchildren. But after using a baking soda rinse for just 2 weeks, her bad breath was completely gone. She now says she can play with her grandchildren to her heart's content. Her family was also amazed by the change. To make it, simply mix a half teaspoon of baking soda into a cup of water. I recommend using it once a day after brushing at night. Swish it around in your mouth, making sure to get to every corner. Pay special attention to the back of your tongue. You must only use food-grade baking soda. Never use the kind for cleaning. It's best to use it about 3 to 4 times a week. People with high blood pressure should be careful, as baking soda contains sodium. It may taste a little bitter at first, but that's normal. Don't make the concentration too strong, just because you want to see results faster. Baking soda's abrasive effect can help with plaque removal, but using it too often can wear down the surface of your teeth. So use it in moderation. I highly recommend a baking soda rinse for people who suffer from bad breath, as neutralizing the acidity is key to solving the problem. Have you ever felt that your mouth always felt fuzzy even after brushing? Diluted apple cider vinegar rinse. The acetic acid in apple cider vinegar has a strong antibacterial effect. This compound effectively removes the main bacteria that cause periodontitis. The acidity of the vinegar also helps soften plaque, making it easier to remove. Medically, acetic acid is a powerful antiseptic that destroys bacterial cell walls. It's effective against a wide range of bacteria, including those that cause gum disease, such as Porphyromonas, gingivalis, and Aggregatibacter actinomycetum comitans. Acetic acid at just a 5% concentration is enough to kill most bacteria. However, this concentration can also irritate oral tissues, which is why it must be diluted with water. Diluting it still maintains its antibacterial effect. Mr. Sato, a 73-year-old man, had a serious case of periodontitis. His teeth were so loose that his dentist recommended having them pulled, but after using a diluted apple cider vinegar rinse for 2 months, his periodontitis significantly improved. His loose teeth became firm again, and his dentist was amazed by the improvement in his gums. To make it, add 1 teaspoon of natural fermented apple cider vinegar to a cup of water. Use it once or twice a week, and always rinse with plain water afterward. This is extremely important. Never use the undiluted vinegar, as it can damage your tooth enamel. It can also irritate your esophagus if you accidentally swallow it. I recommend not brushing your teeth for about 30 minutes after using the rinse. As the acidic component can temporarily soften your enamel, it's also helpful to hold the rinse a little longer in areas with severe periodontitis, but do not exceed 1 minute. I actively recommend apple cider vinegar for patients with periodontitis because it can effectively reduce inflammation without antibiotics. Have you ever been told that you might need to get your teeth pulled because of periodontitis? C. Green tea rinse. The key ingredients in a green tea rinse are the catechins and natural fluoride. Catechins have a powerful antioxidant and antibacterial effect. They are a smart component that selectively removes bad bacteria in the mouth while protecting the good ones. The natural fluoride strengthens tooth enamel and helps prevent cavities. Medically, the main catechin in green tea, EGCG, inhibits the attachment of cavity-causing bacteria like Streptococcus mutans. It also has an anti-inflammatory effect that helps reduce gum inflammation. Natural fluoride is safer than artificial fluoride as there is less risk of excessive intake. The polyphenols in green tea are powerful antioxidants that remove free radicals. This compound helps slow down the aging of gum tissue and suppresses inflammatory reactions. The tannins in green tea also bind with proteins to help prevent bacterial growth. Mrs. Kim, a 68-year-old woman, had dark red gums and severe bad breath for a long time, but after rinsing with green tea for just 2 weeks, her gums returned to a healthy pink color, and her bad breath was completely gone. She now speaks to people with confidence. To make it, steep green tea in lukewarm water for 3 minutes. Water that is too hot can destroy the catechins. After it's cooled down completely, you can use it once in the morning. Using it in the morning will keep your mouth feeling fresh all day. Do not use hot water, as it can burn your gums. If you are sensitive to caffeine, I recommend using it in the morning. As the caffeine can interfere with sleep, steeping it for too long will make it taste bitter. So 3 to 5 minutes is a good amount of time. It's best to make a fresh batch each time. A green tea rinse is especially recommended for people with bad breath and gum inflammation. I often recommend that my patients make a habit of drinking green tea, as they can also use the leftover tea for oral care. Do you often drink green tea? Try using the leftover tea for a mouth rinse. Woo! Clove water rinse. The key ingredient in a clove water rinse is eugenol. This compound has both a powerful antibacterial and pain-relieving effect. It soothes the pain from periodontitis while also removing the bacteria that cause inflammation. It acts as a natural anesthetic and antibiotic. Eugenol is a component that is also used as a temporary filling material in dentistry. In addition to its powerful pain-relieving effect, it also has an excellent antibacterial effect. It also has an anti-inflammatory effect that helps soothe swollen gums. It can also help with recovery after dental treatment. Eugenol at just a 1% concentration can inhibit most bacteria. It's especially effective against gram-negative bacteria that cause periodontitis. It also has a mechanism that suppresses prostaglandin production, which reduces inflammation and pain at the same time. Mr. Matsumoto, a 66-year-old man, had such a severe case of periodontitis that his teeth were loose and he couldn't chew his food properly. He only ate porridge. But after consistently using a clove water rinse for 6 months, his periodontitis and loose teeth significantly improved. He can now even eat hard ribs. To make it, steep 3 to 4 dried cloves in a cup of hot water for about 10 minutes. When it's lukewarm, you can use it once or twice a week. It's important to steep the cloves for 10 minutes until a strong aroma comes out. Cloves have a strong flavor, so if you're a first-time user, it's best to start with just 1 or 2 cloves. Making it too strong can irritate your gums. Do not use this if you are allergic to cloves. If you have a toothache, you will feel the pain-relieving effect right away. You can find cloves at a spice store or a large supermarket. Clove water is especially helpful for pain relief before and after dental treatment. I always recommend clove water to patients with severe periodontitis because it can provide both pain relief and reduce inflammation. Have you ever had a toothache that made it hard to chew your food? Cloves can be a huge help for people like that. A step-by-step guide to oral health. Let's review the 5 natural mouth rinses I talked about today. This will help you avoid confusion when you try them. Salt water. Dissolve a half teaspoon of natural sea salt in a cup of lukewarm water and use it once or twice a day. It's great for gum regeneration and bacteria removal and is especially effective for gum bleeding and bad breath. I recommended starting with a weaker concentration and gradually increasing it. People with high blood pressure should be careful. Baking soda water. Add a half teaspoon of baking soda to a cup of water and use it once a day at night to adjust the pH in your mouth. I said to use only food-grade baking soda and not to use it too often. It's great for people who feel that their mouth is always fuzzy. Diluted apple cider vinegar. Add 1 teaspoon of natural fermented apple cider vinegar to a cup of water and use it about 3 times a week. I said to always finish with a plain water rinse, which is very important. It's especially effective for periodontitis, but I emphasize that you should never use the undiluted vinegar. Green tea water. Steep green tea in lukewarm water for 3 minutes and use it once in the morning. I said that you can get both an antibacterial effect and tooth strengthening from the catechins and natural fluoride. I advise not to use hot water and to be careful if you are sensitive to caffeine. Clove water. Steep dried cloves in hot water and use it twice a week. I explained that it can provide both an antibacterial and pain-relieving effect. It's great for people with a toothache, but I advised against making it too strong. How many of these will you try? Medically speaking, bad breath, bleeding gums, and periodontitis will only get worse if you don't manage them every day. The more you put it off, the harder it is to treat, but if you consistently practice the methods I've taught you today, you can significantly reduce your dental bills and maintain a healthy smile. What I've learned from 38 years as a dentist is that prevention is 100 or 1,000 times easier than treatment. Oral diseases are directly connected to your overall health. If the bacteria from your mouth travel through your blood vessels, it can increase your risk of cardiovascular disease, Voisin diabetes, and even increase your risk of dementia. For older people, oral health is directly connected to your life. When you lose your teeth, you can't chew properly, which leads to nutritional imbalance and a decline in your overall health. There is also a risk of aspiration, pneumonia, if oral bacteria enter your lungs. Try at least one of these things right now. Go to your kitchen and look for some salt, baking soda, and vinegar. These small changes can completely transform your oral health. I'm 75 years old, but I use these 5 rinses interchangeably. That's why my teeth are strong and my gums are healthy. You should try it. 2. Consistency is key. It's meaningless if you stop after 1 or 2 days. Try to do it for at least a month. You will definitely feel a change. It may feel like a hassle at first, but it will become as natural as brushing your teeth once it becomes a habit. And just because you're using these natural rinses, you should not neglect brushing your teeth. Basic oral hygiene is still the most important thing. These rinses are meant to be used in addition to it. You should also get regular dental checkups. From a medical perspective, I highly recommend using these 5 rinses interchangeably because they work through different mechanisms. You can get a complementary effect. When you have a cold, it can be helpful to use salt water or clove water more often. When you have a canker sore, a baking soda rinse can be a big help. In my next video, I'll talk about natural ways to whiten your teeth. This will be especially helpful for people who are self-conscious about their yellow or stained teeth. I will teach you a way to keep your teeth healthy and white without chemical whiteners. Which of these 5 will you try first today? Be sure to make a promise in the comments. Something like, I'm going to start with salt water. That small promise can be the first step toward a healthy future. And be sure to let me know what changes you feel after a week in the comments. It can be a huge source of strength for others.